Hello, everyone. Thank you so much for taking some time out of your evening to join us on the Back the Pack Challenge webinar. We've got a very exciting lineup of people who have come here to speak with you all tonight. So we are very excited to get going. I am Lauren Bodie, your APhA ASP Speaker of the House. Also with us this evening, you will hear from Lauren DePuter, the Senior Manager for Grassroots Advocacy and the APhA Political Action Committee, and also Michael Spira, our APhA Senior Lobbyist, who are part of the Government Affairs team at APhA. Before we get into the meat of our webinar this evening, I hope that you have had the opportunity to join us on another of our APhA ASP webinars. So just a reminder, there are two ways to listen in to the webinar this evening. You can use the telephone if you would like to call in and listen through your phone, or you can listen through your computer and use the mic and speakers. Whichever mode that you choose, please do mute yourself so that we're not getting the background information, the background noise from you and your surroundings. There are also two ways to ask questions during the webinar. You can raise your hand using the raise your hand icon. We will unmute you and you can ask your question verbally. Or if you like, at any point you can submit a written question to the chat box and we will respond to those during the Q&A portion as well. So this evening, we're going to get an update from the APhA Government Affairs team. We're going to talk about the PAC, what it does, the role it plays within our organization and our profession. And we're going to get an inside look from both student pharmacists and new practitioners of ways to get involved with the PAC and how to get your chapter involved as well. So to start us off, we have Michael Spira, the APhA Senior Lobbyist, who is going to talk with you a bit about what the APhA Government Affairs team does. To you, Michael.
Thank you very much, Lauren, and good evening, everybody. I appreciate you taking the time to learn about a very important topic. I'm going to talk first a little bit about Government Affairs, GA, our team, and what we're working on. And I want to give a little background on what we are doing right now on our team. And there are 5 of us in Government Affairs. You'll hear from Lauren DePuter, who handles our PAC and grassroots, and she's going to give an explanation about the PAC. And myself and Stacy Mace is our Senior Vice President of Practice and Government Affairs. And then we have 2 other people, Jenna and Joanne, who handle regulatory. And I am the person responsible for our legislator for Capitol Hill. So as you can see, we handle a lot of different things in government affairs. So on the regulatory side, that is the agencies, CMS, HHS, FDA, and Joanne and Jenna will comment on rules that those agencies roll out, things that affect the profession, things that affect your daily lives for make the laws. I'm on Capitol Hill meeting with policymakers and their staff, trying to influence their decisions, advocating on behalf of the profession, advocating for members to co-sponsor our legislation, meeting with members of Congress and their staff outside of their office, whether it be an event or a reception that they're hosting, and trying to get to know them better and form these relationships and build APhA's network, become a go-to for these offices. That way they can get a better flavor of what APhA is all about and what we are trying to do. And a lot of this is because of the work you guys do and by helping us through our PAC. So that's just a little bit about what we do, and we can always, if you guys have questions, go back to that. So next slide, please. So as you all know, our #1 priority is provider status. And as you see there, we promote access and coverage to pharmacist patient care services. Next slide, please. And I mean, you guys know this substantially better than I, but when a pharmacist is part of the team, patients become healthier and their health care costs are less, and the nation's costs are less. Next slide, please. So hopefully you know these numbers, HR 592 and S 314. That is the legislation, the Pharmacy and Medically Underserved Areas Enhancement Act. HR 592 is the House version and S is the Senate version. And the legislation would provide access and coverage to pharmacist patient care services under Medicare Part B in medically underserved communities as long as that pharmacist followed the state scope of practice. That's our bill. It's very simple. It's those 3 points, state scope of practice, medically underserved communities, and access and coverage under Medicare Part B. And hopefully you know that we being APHA have had this campaign going on for a couple of years now. And you can go to the website, Pharmacist Care, and you will be able to sign up as a supporter. You'll be able to send a letter to your member of Congress asking them to support the legislation. If they have already supported the legislation by co-sponsoring it, you would then be able to send a thank you letter. We ask and we ask and we ask members of Congress to do things, but it is nice when they receive that thank you for doing that work. And also on the website, we have a lot of background material, a lot of information, a toolkit on what you can do and other ways to learn about the campaign. Next slide, please. So APHA's number 1, 2, 3, 4, 5th priority is provider status. But what else are we working on? What other things are we doing? As you know, our country is in an epidemic, a prescription drug abuse epidemic, and that is not a Republican nor a Democratic issue. It is a bipartisan issue that members of Congress are working on. And there have been many hearings in the House and the Senate on this issue. There have been many bills introduced in the House and Senate on this issue. And we have been called up to Congress to meet with members of Congress and their staff to discuss solutions. We have been asked to send letters to committees with our points that we feel would help reduce this epidemic. And that is legislation, that is a topic that can move this year. That is something that can go forward because we are in an election year, and the later you get in an election year, the less legislation is likely to move because things become more partisan. And a lot of people will say, how do I get involved in the campaigns? How do I get involved with legislators? I want to promote and support those that support the profession. Go to their websites. You can look on there. If they're already in the House or Senate, you can see on their websites their healthcare viewpoints. But they will also have a lot of the same ideas on their campaign websites. See if they're a co-sponsor. Maybe they've sent a letter or co-signed a letter. And then from then, if you're interested in going and working on their campaign, call up. Become a volunteer. You can put a sign on your lawn. You can put a bumper sticker on your car or in your window. There's plenty of ways. And another way is, of course, supporting our PAC, and Lauren DePuter will get more into that as we move forward. And we're going to be that first weekend of March. I hope you all are there. We're going to be in Baltimore for our annual meeting. Come by the booth, the Government Affairs booth, and Lauren and myself and the rest of the GA team will be there to help answer your questions about the campaign, about the legislation, or anything else you'd like to talk about. That's what we're there. We're here to help and serve you and advocate for the profession. So I guess I can take questions, or we can take questions at the end, and if we can just take them at the end, we can just go to the next slide. So I'm now going to hand it off to Lauren DePuter, who is going to educate you all and answer any questions you guys have about the PAC. Lauren?
Hi, everyone. I'm going to go over just the basics of what a political action committee is, in case you don't know. Next slide. Okay, so the main goal of our political action committee is to protect and promote the pharmacy profession. So we're very lucky that the American Pharmacists Association has a PAC because it allows us to connect with our members of Congress and educate them on the importance of our legislative issues such as provider status. Basically, what a political action committee does is it pools APHA members' resources so we can positively affect elections and get our advocates reelected to Congress, or if they haven't been in Congress yet, elected as new members to Congress. As you all know, we're in an election year, so there's a lot of differences between PACs, and you might have heard of super PACs recently. Super PACs and PACs are completely different entities. PACs are very highly regulated and full transparency, and they can only contribute $10,000 maximum to an election. So please keep that in mind as you go on with Back the PAC, that if anybody ever has any questions about everything they're hearing in the news about super PACs, they're two very different things. Next slide. So basically what we do with the funds that we receive is that we distribute them to members of Congress. These disbursements are based on several different criteria. Some of the criteria are if they're on some of our key committees, if they have control of legislation that affects pharmacists around the country, if they co-sponsor provider status, for example. Those two bills are very important to us, so we like to show our support that way. It really shows, the PAC really shows to members of Congress that they need to take us seriously, that pharmacists care about the future of healthcare in the country and their patients. So we have an 8-member board of APHA members for the PAC Board of Governors, and they go through every single disbursement that we want to take out of Political Action Committee. They have to approve it. So it's a very highly regulated process. One of the programs that I've started in the past couple of years was having local APHA members, especially previous students that have supported the PAC in the past. I've had them attend events for their members of Congress in the district on behalf of APhA-PAC. So we have Jordan Ballou is on the phone with us tonight, and she attended an event for Congresswoman Renee Elmers. So if you want to give us a summary of how that was and what it was like to attend on behalf of APhA-PAC, that'd be great.
Absolutely. Thank you, Lauren. So yes, I had the opportunity, I went to pharmacy school at Campbell University, which is in the congressional district of Representative Renee Elmers, and I was able to attend on behalf of the PAC, the APhA-PAC, and personally thank Congresswoman Elmers for supporting the provider status bill that's in the House during the last session. And it was a really enjoyable experience. I had the opportunity to meet with several of her other supporters who were attending the event. I spoke with her husband, who's a physician, and she herself is a nurse and by trade. And so I had a really, I got to sit down with her probably for a dedicated 15 minutes, and we just kind of talked about the, healthcare today, particularly in rural areas, similar to where Campbell is and her district. And how pharmacists really could have an impact on patients that are living in those areas, and what this bill would mean to healthcare in general, but particularly our profession. And it was a really great experience. It was very informal. It was very kind of casual and laid back, and I think that I was really nervous when I was going. I was like, oh my goodness, I'm going to be around all these people, but it was, because it was so informal, it was just really, really nice, and I really enjoyed it, and I really enjoyed the opportunity to get to go and represent APHA.
Thank you, Jordan.
Thank you.
And thank you for attending on behalf of the PAC. And also, just Renee Elmers is a co-sponsor of HR 592, which is one of the reasons why APhA-PAC supports her reelection to Congress. So students have a huge impact on APhA-PAC. You guys make up half of APHA membership, so you are very important to us, and we really hope that you guys all get involved. This is the future of your profession, and I know that you guys take really good care of your patients, and this is really about you guys. So I really hope that you can all get involved and really use the PAC, really be able to utilize the value of the PAC. So Back the PAC it goes on all year round now, but it's ending on February 26th, and basically it's between it's between all the chapters and to see which one can raise the most money for APhA-PAC, and then we give out the award at the annual meeting, which is happening in Baltimore this year, the first weekend of March. We'll recognize the 5 top teams at the annual meeting, so please get involved. Here are some ideas for PAC fundraising. It is an election year, so it is a good time to do some of these events, especially the ones that are more geared towards campaign and the election. We're also here, APhA staff is also here in case you need any provider status materials. We have plenty of them, so please always just let me know. Okay, so here is all the legality around PACs. There are, since we can only fundraise from APhA membership legally, you just have to be aware that when you're doing an event that you're only soliciting for funds from actual APhA members. And please make the events nonpartisan because APhA-PAC is a bipartisan PAC. So please just make sure that it's not really geared towards any of the parties. Please use this disclaimer at the bottom as well for FEC regulations. And please don't, every single contribution has to be from an individual member. We can't take money from any chapter accounts.
Thanks so much, Lauren. So now we're going to hear from a student pharmacist coming to us from Stanford University. Angie Marcella is currently serving as the policy vice president there. And Stanford University was actually one of the top 5 schools who placed in the Back the PAC challenge last year. So she's got a lot to share with us, so I'll turn it over to you, Angie.
Thank you so much. Okay, so I wanted to go through a few events that we have had at Stanford that have been really profitable and successful in just getting our members educated on what APhA ASP is doing and how they can get involved without it, being so daunting. So if we'll go to my first slide about this is a fundraiser that we held last spring. It was such a success that students have actually been requesting and asking when it's going to be happening this year. Really simple concept, but very profitable. Planning does require a few weeks of prep. I would say about 2 weeks of prep time. You want to get your email out for volunteers about 2 weeks in advance. Remind those volunteers about a week in advance. And make sure you advertise to the students that are members of APhA, your ASP chapter, and that way they'll all know when they need to come out and bring those checkbooks to school. This semester is a really excellent time to utilize this event with holidays like Valentine's Day and Easter coming up. For instance, we are hosting ours right before Valentine's Day to try and entice members to maybe buy something sweet for their sweetheart or for themselves. Perfect. All right, so going on to an event I hosted this year called Pastries and Policy. This was really just to get our year started off, get people interested in joining our stand committee at the school, and also to educate them in a fun way about what APhA ASP is doing for them and how it can impact us in Alabama. We played a game, as you can see here, with our own Bob Barker, Dr. Hogue, and very successful event. We didn't use this one as a fundraiser, but it would be something very easy to turn into a fundraiser if that's something you were interested in doing, or if you're just interested in getting more members interested in policy the way I know many of you are. I know it can be a little difficult to sometimes get people interested in policy at our level. Good. Alrighty, and then an event I hosted capitalizing right off of us coming back from MRM earlier this year was the we did our policy and advocacy booth, and we did a letter writing campaign here where every student who gave us their information for the letter writing campaign received 1 free pastry. And those of you who I'm sure are like myself with a limited budget to work with, This was not an expensive event to put on at all. I went to Publix and got some of those really delicious cookies. They sell like 2 dozen in a box for $2, and just put like 2 of them in a baggie. And then if they wanted an additional pastry, because we have most of our classes at Stanford are in the mornings, so they love the idea of having like a pastry or a cookie with their coffee in the morning, so that worked really well. And we used all those additional funds to go toward a PAC fundraiser.
Thanks so much, Angie. I know you guys in the audience probably have some questions for her, so there is going to be an opportunity to pick her brain and ask for more of her secrets by the end of the webinar. For the moment, I'm going to move back to Lauren DePuter, and she's going to tell you how to actually, how students can actually contribute to the APhA-PAC.
Sure. So there's 2 main ways that you can donate to the PAC. You can go online on our website and donate very easily online, or you can use text to donate, which we urge you to use this tool. We're one of the few PACs that use text to donate, so please utilize this. If you're doing an event, you can urge your attendees to just, all they have to do is text action to 50155, and a link will pop up. They'll be asked how much they want to contribute. They reply, and then they'll be prompted with a link, and then they can contribute via their credit card over this link. And please be aware that at these events, the most effective way to fundraise is by peer-to-peer fundraising. So even if you're not doing, if you can't really put anything together that elaborate, if you just ask a couple of your fellow students to contribute to the PAC, that makes all the difference too. So please, just if you're capable of just doing that, that's very effective as well. And you can choose on text to donate, you can choose there's a drop-down menu on choosing your chapter, and there's a blank field when you're donating online to fill out where you want your contribution to go. So you can fill out your chapter there too. And this is just the history since 2011 of Back the PAC. It used to be what was called Advocacy is High. As you can see, we've been raising a lot the past couple of years, so we hope to raise more than we did in 2015, so please help us get there.
Thanks so much, Lauren. So I know that I remember participating in Winter is Cold Advocacy as Hot as a first-year student pharmacist, and so to me as a final-year student pharmacist, this is a really important and impressive graph for me to see how we as a body of student pharmacists have really stepped up and said, yes, our profession is important to us, and yes, we are going to support it. And so I cannot wait to see what these numbers are going to look like over the next year, and I so appreciate all of you for your interest and for your advocacy in making this happen. So at this point, we would love to hear from you. What questions do you have that our panelists can address? As a reminder, there's 2 ways you can ask your question. You can submit your question via the chat function on the right-hand side, or if you'd like to raise your hand, we'll unmute you and you can ask verbally.
So Lauren DePuter, one of the first questions we have is related to the text to donate. When you text to donate, does that go onto your cell phone bill or does that go onto your credit card bill? How does that process work there?
It goes onto your credit card bill. It's not like, I know the American Red Cross does it where it can go onto your credit card bill. Ours is totally different. You have to fill out your credit card information. That link will take you to a credit card page, and then you fill out your credit card information. With the other option, you can only do a maximum contribution of $10. We don't have a limit for the maximum contribution, so it goes all via your credit card.
Great, thank you very much. Another question we have here is for you as well. Can you give us a quick overview of some of the pitfalls that chapters have kind of gone through when it relates to some of the rules and regulations, some of the things that you've seen over the years that maybe chapters could do a better job of when following some of those federal rules?
I think that a lot of the times, you know, trying to find just APHA members might be a little difficult. So you're not soliciting outside that class. But if you're doing it if you're going through your chapter, then it should be okay. Another problem, I've been trying on my end to get a lot more of the alumni involved. So it's not just on you students to fundraise. So I've been trying to get a lot of them to match. So if you ever want to contact me, I can help put you in contact with some of our leadership, and they can help you with fundraising if you're looking to fundraise from your alum. That's an option too.
Great, thank you. And I think it's important to note on that screen there where we had the listing of the amount of money that the students raised, that does not include the amount of money that was matched by our pharmacist. Question from Evan Colmenares. He said, what are some of the most successful / innovative back-to-PAC fundraisers from previous years? So Lauren DePuter, kind of start with you, and then Lauren Bodie, if you have anything followed up from there.
I know University of Florida has dress down days that they do for back-to-PAC, which has been pretty successful. So basically they sell tickets to their fellow students for them to then they're able to dress down to their classes. I also know that they had a couple of they offered, I think, to one of their professors. One of their professors offered to shave their head too. That was a fun way for them to be able to fundraise as well.
One fun event that I've seen is at a chapter meeting or maybe a pizza and policy to play like buzzword bingo. So it just requires a little bit of cooperation from the presenter, and then you can print out bingo cards that have specific catchphrases or key words that are likely to come up. This was something that at University of Tennessee we did when we were visited by the president of the Board of Pharmacy of Tennessee. He was great. He played along with us, and so it was a nice, like, fun way to get people to participate in policy because they get to yell bingo in the middle of a general chapter meeting. We sold each bingo card for about $1, and I think we raised maybe $30 or so for the PAC from that one event. And that was just one of many, but it was just a fun way to help back the PAC and get engaged in policy.
Great, all good ideas. This question is for Michael Spira. It's from Lauren Kirk. How many co-sponsors are there in the House as well as in the Senate? And then where do you see the trajectory of the provider status bill?
Thanks for the question. So we currently have roughly 60% of the House of Representatives, 262 co-sponsors, have supported the bill. In the Senate, we have 40 co-sponsors, so 40% of the Senate has supported the bill. So that is amazing. There are thousands of bills that have been introduced in both the House and Senate, and we have one of the most co-sponsored pieces of legislation out there. And as I said earlier, it's an election year. We've all said it, and we know. That means we need to move the bill at the beginning of this year. So we are working with the chairman of the Energy and Commerce Committee, Mr. Fred Upton, to move the bill this year before we get too late in the calendar. So we're hoping through member-to-member conversation, member of Congress to the chairman, that we get a legislative hearing markup in the next couple of months and take it from there. So there is momentum. There is great enthusiasm. The chairman himself said you can't ignore a piece of legislation that has this much support, especially from key committee members. So it's great energy, great momentum, and a lot of that has to do with you all on the phone and your colleagues at your chapters.
Great, thank you very much. This probably goes back to Lauren DePuter and Lauren Bodie. Scott Brewster from ETSU asks, I know the number of chapters participating is growing over the years, doubling even last year. How can a school best start for the first time donating to the PAC? Are there any easy to kind of start up type of projects? And maybe Angie, if you want to jump in there too, you can do that as well.
I mean, if you're just starting off, definitely utilize the text to donate. I think that'd be a really easy way to help them get involved. I think making, especially if it's the first time, you know, just making that connection to provider status, using the PAC as a way to get that, to show the value of the PAC.
I would say one of the, if you are at a chapter that has never participated in Back to PAC before, then I would encourage you to do an activity that you can do in conjunction with, say, like a general chapter meeting or some other APhA ASP function. So you don't necessarily have to plan an entire event around Back to PAC, though of course we would love it if you did. But even having an activity that can help educate student pharmacists at your chapter and help raise some money for the PAC, that would be a really great start, a really valuable addition to the Back to PAC challenge. So that's where I would encourage new chapters, or I should say chapters new to the Back to PAC challenge to start. Angie, what perspective do you have?
Well, someone that I've had to give policy a little bit of a facelift at Sanford. While we have an excellent supportive school, our students over the past several years kind of got a sour taste for policy in their mouth. Not through anyone's fault, just more of policy can be a bit daunting, especially if you're a new chapter. It can be extremely daunting, I imagine, for you. So if you look at some of the materials like that I've done, like flyers and things, my motto is, if you, and I tell officers in all the organizations I'm involved in, if you make it pretty, people will more than likely not throw it in their junk mail, and they'll more than likely hold on to it and actually be more interested. And as far as doing an easy event, the one I spoke of, the Ties for Policy, is a very easy event that doesn't require a whole lot of effort up front from you and can be very profitable, especially just starting out. And as far as educating, I would love to send you some notes and questions, if you would like, on doing the Policy is Right, because that's a really fun game, really easy to put together. And it's a great way to educate them on what policy does, because a lot of times that's really your first step.
Excellent, great job. Michael, I'm hoping I'm pronouncing correctly, I think it's Free, asks, my chapter is looking to do a President's Day trivia night. Am I allowed to collect money from the members and make a donation in my name, or is the text to donate / online donating the only way to accept donations from members? So when you have group events, Lauren, Deputer, what's the best way to collect money and kind of keep track of that?
You can collect money and then make it. You can make it via your name. Just make them aware that that's the way that it's going to be processed, because I don't want a student coming to me and if they see a list of PAC contributors and they're not on there. So that's fine, but just make them aware that that's going to be the case.
Can you accept a spreadsheet from a school with the list of names and how much they donated in a joint check, or does the check have to match up with
I could do that. Yeah, that would be fine.
Okay. So Michael, if you wanted to keep track of that and kind of do those receipt books where everybody kind of gets a receipt, and then you make a spreadsheet and send that to Lauren, then everybody who donated would get credit, and then they'd get their name and their information in the PAC materials, and then they'd be eligible in the future to get the newsletters and that sort of thing to help kind of donate. APhA writes, in your experience, what has been the most effective explanation to motivate students to donate to the PAC? Lauren, Deputers, will probably start off with you, and then Bodie.
Wait, sorry, could you repeat it?
Sure. In your experience, what has been the most effective explanation to motivate students to donate to the PAC?
Oh, sure. I think by making that direct connection between if you look at right now, we're looking to get co-sponsors for the two bills, and if you make that connection between the PAC and gaining co-sponsors on the bill, that it's very important about educating legislators so that they become co-sponsors on the bill. That is very effective. I don't think that people often make that direct connection between the importance of the PAC. So I would highly recommend that.
Great.
I think for me, I've come to think about the APhA-PAC as a complement or something that goes hand in hand with grassroots advocacy efforts that student pharmacists are so effective in and so engaged in. And I think you really see that in what Jordan talked about, of how delivering that PAC check enabled her to have a very good personal connection with her member of Congress, and made that like direct connection with the profession of pharmacy. So to me, I think that it is a core part of grassroots advocacy. And so the $5 for me to donate now, you know, yes, I could definitely go buy a venti soy latte, but $5 towards the future of my profession, a profession that is going to enable me to serve patients and have a very like long and fulfilling career, that's so much more valuable to me than that latte.
You might also want to emphasize that Congress really will take an organization, members will take you a lot more serious if you have a strong PAC, because it really does speak volumes to them that members are motivated enough to be involved in their political action committee. So you can also emphasize that point.
Great. All good discussion and great questions from the audience. That's all I have right now, Lauren and Michael. So if anybody else has any questions, Lauren's got a couple more slides to close up on here. We'd happy to answer those, but I think you can move on.
So I hope that you have had some of your questions answered and that you have some ideas sparked from our conversation this evening. Moving forward, though, we do have lots of resources for you on the APhA website, pharmacist.com. Head over to the Government Affairs page. That's pharmacist.com/advocate. We've also got some resources for you on the policy and advocacy portal on the student section of pharmacist.com, and also Michael and Lauren are kind enough to be resources for us, so there are their email addresses there. So at this point, I also would like to invite you to some upcoming webinars we have. Tomorrow we have a webinar that I'm particularly looking forward to as I prepare a journal club, a resolution to research webinar series. The first one is Intro to Biostatistics, which is tomorrow from 7 to 8 p.m. Eastern Standard. And then for all of you who are lucky enough to be serving as your chapter delegate for the APhA 2016 APhA ASP House of Delegates, we will be meeting Thursday, February 25th at 9 p.m. for our orientation. So other than that, I thank you so much again for being on the webinar this evening. Please do reach out to us with any further questions you have, and go on and back the PAC. Thanks so much. Have a good night.